Radiology is at the centre of modern medicine. From dentistry to oncology, X-ray imaging is an indispensable tool, diagnosing trauma, detecting disease, and guiding treatment strategies. Yet, remarkably, until now, the vacuum tube X-ray technology used today has remained relatively unchanged for the past 100 years.
Next time you're unfortunate enough to go to a radiology suite, have a look what's around you. Behind you there's a very thin panel made in a semiconductor foundry. That's the detector to replace the film. Everything else there is driven by the source. There's something in front of you about 2 meters away. It probably weighs between 30 and 50 kilos. It's got an old clunky vacuum tube inside it, big cables coming in for the high voltage, and then a huge gantry that carries that is built into the roof. And over in the corner, there'll be a thing the size of a server rack, which is all the electronics and high voltage transformers, etc. We're going to replace all that with something that's basically the size of a laptop and weighs 10 to 15 kilos. It will be the first medical portable X-ray that will be widely deployed. If you think about it, you've seen this journey before. So if you think about your vacuum tube TV that you used to have a few years ago, it took 2 people to lift, and now you have a small, thin, flat panel. That's what we're doing. We're producing a flat panel X-ray source.
It must be hugely exciting to see something come into fruition that could really transform healthcare.
Absolutely. Imagine someone in a nursing home falls over. Now they can be imaged in situ, and if they haven't broken their hip, they've just bruised it, then potentially they can be left at the nursing home in the care of a general practitioner. They're much happier because they've not gone through 2 ambulance trips. They've not had to wait on a gurney outside radiology. They've not had to wait a few hours in order to get the results. And basically, everyone wins in that situation.
Dr. Max Ryan is Clinical Director and Consultant Radiologist at Cork University Hospital.
X-ray technology has been around for approximately 100 years. I remember well my father telling me a story about my grandfather back in the 1930s who learned Röntgenology from one of Röntgen who discovered radiology in Germany. He brought back this prototype and loaded it onto his van and went around to patients to take portable radiographs of these. But I'm amazed is that we haven't actually moved on since over that 80-year period.
Outpatients, yeah.
It can be very uncomfortable, particularly if a patient's acutely unwell, to come down to the X-ray department. It can be quite difficult for the patient to get in and out of the machine. For instance, that if you had a patient with a fractured wrist, it can be quite difficult and quite painful for that patient to position her wrist joint, his or her wrist joint, for a radiograph. What's exciting about this new technology is that it's very small, it's portable, it's highly maneuverable, and for the first time, we'll be able to bring radiology to the patient.
The concept, originally developed at UCLA and the European Space Agency, has now made its way to Cork, where Tyndall scientists will make it a reality. Carla Webster is one of the business technologists at Tyndall that initiated the project with Radius Health, and originally they were only looking at one element of the whole project.
There's about 11 elements to this technology. And then when they came into Tyndall, they realized that actually we could do between 7 and 10 of those elements here in the Institute. And that was going to save them time, money, and expertise.
What is groundbreaking about the new technology is the ability to reduce massive old machinery down to the size of a computer chip. Existing X-ray machines function via a tungsten filament at one end of a long vacuum tube, which emits electrons when heated. They accelerate down the tube until they hit a metal electrode, causing it to produce X-rays. The new system, more than 20 times smaller, actually exploits technology originally developed for space satellites. The secret of the device is a layer of pyroelectric crystals which emit electrons when heated. These crystals are covered by a layer of micropyramid structures which control and direct the electrons, eventually converting them to X-rays.
This is layer 1, layer 2, and there's about 10 or 11 layers that we have to assemble together. These then form individual tiles or chips, which are separated, and then they're reassembled together to form a flat screen or a solid-state screen, similar to what's in your laptop.
So you have all the different parts of the jigsaw. You need to now put them together to create a whole picture.
That's correct.
What stage of the design are you at?
Well, we've moved beyond a proof of concept stage. So we've demonstrated that these devices can generate X-rays. We're now moving to product development where we can develop the technology robustly so that it has design for manufacture built into it. So we're linking in with different entities like the National College of Art and Design to design what that housing should look like, and we're also linking in with contract manufacturers.
The new portable X-ray will be compact and light, about the size of a laptop. It'll weigh about 10 kilos, which is no heavier than your average carry-on luggage on a plane.
The other thing that's really cool about this, and it's probably the coolest thing, is that you'll also get 3D images instead of the 2D. If you think about our devices as effectively moving the point of origin of the X-ray across a large plane, we're getting multiple views of the person's chest. Because we're getting that multiple view, that multiple stereoscopic view, we can create a 3D image, and that's much more sensitive in terms of looking for specific clinical features.
So it's not just making it portable and more cost efficient, we are getting better images.
It's going to be better.
This is going to change the process completely. At major road traffic accidents, for example, the first responders, these are the first people who actually arrive at the site of the accident, and they will be able to radiograph that patient to see if the patient has significant spinal or thoracic injuries. Now, the other thing is that these radiographs can be relayed back to the X-ray department for interpretation. So it means that treatment can be initiated at the site of the accident rather than having to wait for the patient to be transferred back to the hospital unit. This undoubtedly will save patient lives.
It's simple and it's basic, but most of healthcare is doing simple, basic things right immediately when the patient needs it.